Hello and welcome to this video. My name's Chris, I'm an Australian GP, and today we're going to be going over arthritis. What is it? What types are there? Essentially, Arthritis 101. This is a continuation of a series I'm doing currently, which is Health Conditions 101, so if you do have any suggestions or requests for me, let me know. But without further ado, let's jump into arthritis. So arthritis isn't just one type of condition. It's essentially arthritis itself is the inflammation and swelling of joints, which may be the large joints, including the shoulders and hips and knees, or the small joints, including the ones in between each of your finger bits. The cause, understandably, will vary depending on the type of arthritis you have. So let's break them down in a brief manner of speaking. The most common type of arthritis is osteoarthritis, or wear and tear arthritis. Basically, osteoarthritis is the breakdown of cartilage due to wear and tear, cartilage being the connective tissue which is between bones within a joint. It is more common as we age. It often affects the fingers, the spine, the knees, the hips, the shoulders, and even the toes. Risk factors include being overweight or obese, having had repetitive injuries to that joint, congenital abnormalities, hypermobility, certain professions, diabetes, menopause, and certain types of exercises. The next type of arthritis is rheumatoid arthritis, which is an autoimmune condition. That is, your body attacks its own tissues. In this instance, the tissues of the joints. We don't quite understand why this happens. We do know that tendencies do run in families. The most common areas affected include the fingers, especially the proximal interphalangeal joints, inter being in between and phalangeal being, well, these are the phalanges, so 1, 2, and 3. So proximal being the closest to you, so proximal interphalangeal joint, the wrists, and the feet. That being said, the elbows, the shoulders, and the knees are also quite common. Next, we talk about the spondyloarthropathies. This is a type of inflammatory arthritis which can affect many joints, but in particular the spine. It occurs more often in males than females and tends to affect people in their teens and 20s. It varies with other arthritises because it tends to be an inflammation of the area of the bone where tendons and ligaments attach, known as the entheses. The most common type of spondyloarthropathy is ankylosing spondylitis. Other types do include reactive arthritis, psoriatic arthritis, and enteropathic arthritis associated with other conditions like inflammatory bowel disease. Juvenile arthritis, as the name suggests, affects children. Juvenile arthritis is also an autoimmune condition. This type of arthritis causes a persistent swelling and pain, and because it quite often affects the knees, limping is also a major symptom. Complications of juvenile arthritis may include growth problems. Reactive arthritis, again as the name suggests, is a reaction to, in this instance, a bacterial infection, most commonly in the genitourinary tract or the gastrointestinal tract. Reactive arthritis tends to be more common in 20 to 50-year-olds. There is also a link to some genetic markers, though not everyone who gets reactive arthritis has this predisposition. I kind of touched on psoriatic arthritis in the spondyloarthropathies, but just to break it down a tad more, psoriatic means related to psoriasis, which is a skin condition. This skin condition is autoimmune, therefore its related arthritis, psoriatic arthritis, is also autoimmune. It typically attacks the larger joints of the lower limb, but it can cause symptoms in other joints too. As with most arthritises, main symptoms include swelling, pain, and difficulty moving the joint. Psoriatic arthritis, as a side note, actually also very commonly affects the lower back. Septic arthritis is a medical emergency. This is because there is an infection in the joint's synovial fluid, or the fluid that stops bone rubbing on bone and whatnot and kind of lubricates the joint, as it were. It occurs more commonly in children, but we do need to suspect it anytime we have a red, hot, swollen, warm joint. Joints tend to become infected because of some sort of injection, injury, or other systemic infection. So if someone's already septic for some other reason, such as a urinary infection that got out of control, for example. Finally, gouty arthritis, or gout, is also a type of arthritis. Gout occurs because of an accumulation of something known as uric acid, which is a byproduct of the body breaking down purines, which are a type of protein. Most commonly, the big toe is the joint that's affected for one reason or another. And gout symptoms tend to mimic septic arthritis: red, hot, swollen, and warm to touch. Typically, people with gout will have recurrent attacks of it, so you can base on their history whether or not it's more likely to be gout or septic arthritis, but again, due diligence is required. Foods that have purines and therefore may increase your risk of a gouty flare include alcohols, such as beer, red meats, seafood, and fructose. As with every condition, the investigations will vary depending on you, your unique circumstances, and your symptoms. But if we suspect you have a type of arthritis, investigations may include an X-ray of the joint to see if there is degeneration or clinical signs, or I suppose radiological signs of the type of arthritis we're suspicious of, and blood tests. Of course, investigations will vary depending on you, your unique health needs, and what kind of arthritis we're suspicious of. So after a thorough history and examination, we may order an X-ray, for example, to look at the joint spaces, other degeneration signs or signs of degeneration, and other signs of a particular type of arthritis. We may also order blood tests to look for genetic markers and inflammatory markers. Sometimes we'll even remove fluid from the joint, known as arthrocentesis, to look for things like gout. And mind you, I didn't mention it before, but there are other types of gout too, like pseudogout, but we are not going to go into that today. Treatment for arthritis will vary depending on the type of arthritis you have and its severity, but may include physical therapy to strengthen the muscles around that joint and strengthen the joint itself, anti-inflammatories, including non-steroidal anti-inflammatories like ibuprofen or similar things, simple analgesics like paracetamol, counter-irritants like a capsaicin cream, which essentially overwhelms the nerves to not recognizing that you're in pain, and steroids, which may be injected into the joint itself because steroids are a potent anti-inflammatory. Sometimes you will need surgery or surgical intervention, but again, this varies a lot. So that's Arthritis 101. I hope you've learned something, and if you want me to deep dive into any of the types of arthritis, please do let me know. I'm doing quite a few more videos in this series, so if you do have topics you want me to cover, let me know. Don't forget to like, subscribe, and leave me a comment. But until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.